Let's talk about constipation. Sounds gross, doesn't it? Nobody likes talking about poo, and nobody likes talking about their bowel movement habits. It can be embarrassing. And in many cultures, it's something to be kept private. But constipation affects many patients diagnosed with cancer or advanced organ illnesses. So in this video, I will be discussing what constipation is, why it happens, and its common causes in the setting of advanced illness and palliative care. I will also be addressing opioid-induced constipation. Let's talk about it. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video of this channel for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. In this video, I will discuss the definition of constipation, the physiology behind why it happens, and its common causes, including opioid-induced constipation. And in part 2 of this series, I will discuss the strategies and medications used in the prevention and treatment of constipation in the setting of advanced illness and palliative care. I want to be clear in distinguishing constipation in this setting from that relating to motility disorders, such as irritable bowel syndrome, as the approach and treatments are different. So what is constipation? Constipation in adults can include having a slower movement of stool through the intestine, resulting in fewer than 3 bowel movements a week, the presence of dry, lumpy, or hard stool, the need to strain during bowel movements, the sensation of incomplete evacuation, and/or the need of manual removal of stool from the rectum. To make an accurate diagnosis, doctors use the Rome 4 criteria. Now, in my experience, many patients are hesitant to openly discuss constipation-related symptoms with their medical team. These symptoms can have a significant negative impact on one's quality of life, but is often not talked about until it has already made the negative impact. Now, if I'm being totally honest, I will also admit that it can be very awkward for medical teams to ask probing questions about their patients' bowel movements. So in the end, both parties end up skirting around the issue. Take home point. Do not be hesitant to talk to your medical team about your bowel movement habits or any concerns you may have about your stool's appearance, even if they don't ask you about it. To better appreciate how the different causes of constipation affect the intestines, we first need to understand how things normally work. After the food you've eaten has been partially digested by the stomach, it passes into the small intestine. This mixture of food and stomach acid is called chyme. The small intestine is where the majority of nutrients, fat, water, and electrolytes are absorbed. After traveling the length of the small intestine, the digested chyme and waste then enters the large intestine. How does the watery waste turn into formed stool? In the large intestine, the chyme and waste is pushed up the ascending colon by intestinal smooth muscle contractions called peristalsis. It then gets pushed across the transverse colon. Throughout the large intestine, water and electrolytes are absorbed, turning the watery waste into formed stool. This is a very important process, as without this action, we would have watery diarrhea all the time. The waste and forming stool continues through the descending and sigmoid colon and ends up in the rectum. And when the rectum gets full, the stool gets released into your toilet. Another important function of the large intestine is the absorption of certain vitamins, such as vitamin K and several B vitamins, including B12. Bacteria that live within the large intestine produce these vitamins, and the large intestine can then absorb them. It's fascinating how this works, but it is beyond the scope of this video. How does the large intestine contribute to constipation? It's the water absorption in the large intestine that can contribute to constipation. You see, the longer the stool remains in the intestines, the more water is absorbed from it, resulting in dry, pebble-like stool. This is the reason why having a constantly moving intestine is so important. The pace at which digested food moves through the intestines, or the intestinal transit time, is a very complex process. It involves several different neurotransmitters from the nervous system and specific hormones released by the gut that coordinate the muscles around the intestines to physically propel things along. Furthermore, none of this is under our voluntary control. So factors that disrupt or interfere with this brain-gut connection or axis will influence the speed at which the intestines move. So practically speaking then, what are the causes of constipation that are relevant to me, the patient? Let's start by talking about situational and lifestyle causes. Situational causes include the lack of privacy for toileting, the inability to sit comfortably on the toilet, and the need for physical assistance in order to get to the toilet. These scenarios often lead people to hold it in for longer than they should, and this can lead to constipation. Let's talk about lifestyle factors. A sedentary lifestyle can cause constipation, as it results in decreased peristalsis. Exercise, on the other hand, does the opposite, as it can stimulate peristalsis. In terms of diet and intake, diets low in fiber and a decreased fluid intake are known to contribute to constipation. Let's now talk about medical causes. We can start by talking about structural or physical changes to the intestines. Abdominal or pelvic masses from cancers can physically get in the way. They can push on the intestines or they can invade the intestines, making it less able to propel contents along. Illnesses that directly affect the intestines itself, such as hernias, diverticulosis, and colitis, can also have an effect on how well the intestines move and its ability to absorb water and nutrients. Hormone changes, such as hypothyroidism, can result in decreased peristalsis. Now, earlier in the video, we talked about how there is this complex interaction between the intestines and the nervous system. Cancers or injuries that affect the brain or the spinal cord can lead to a communication disconnect between the affected nerves and the intestines, and this can result in the intestines moving in a less coordinated way. Similarly, autonomic nervous system dysfunction, such as that seen in Parkinson's disease or in other neurodegenerative illnesses, nerve damage from poorly controlled diabetes, and paraneoplastic syndromes caused by some types of cancer, can lead to the intestines moving in a discoordinated way. There are also several electrolyte and metabolic changes that can cause constipation. Dehydration is one of the more common causes. By not having enough fluid on board, your body will try to preserve and hang on to as much water as possible, and this can directly lead to dry and hard stool. Often seen alongside dehydration, low levels of electrolytes such as sodium or potassium can lead to constipation. On the other end, constipation is a classic sign in patients with high calcium levels, commonly seen in certain cancers, especially ones affecting the bones. Constipation is also a frequent finding in patients with kidney impairment, although the mechanism is multifactorial. Furthermore, there is a known link between cognitive changes from dementia and constipation. Dementia can change a patient's toileting behaviors, can affect their diet and their ability to stay hydrated, as well as their ability to communicate the urge or need the toilet. Looking at it the other way, ongoing constipation can influence or alter the brain-gut axis, which in turn can further worsen cognitive decline and cause worsening confusion. And this becomes a worsening cycle, unfortunately. The next group of causes is a big one, and that's medications. Medications play a very important role in healthcare, but some medications can also lead to constipation as a side effect. Let's start with a common example: iron supplements. Iron can cause constipation in many patients. It's the extra unabsorbed iron that slows intestinal transit time down. Diuretics or water pills often cause constipation due to the dehydrating effects, as well as changes to electrolyte levels. Antidepressants and anti-nauseants that work by having an effect on the neurotransmitter serotonin can also lead to constipation. Why? Serotonin plays a key role in regulating peristalsis. As such, any medication that affects serotonin will also influence how well the intestines move. Similarly, medications that influence the levels of the neurotransmitter acetylcholine, such as sedatives and medications that relieve muscle spasms, can also decrease peristalsis, resulting in longer transit times. Now, I am not advocating that you stop these medications. Medications all have their intended purpose, but it's also important to know that they can all have side effects too. So best to speak to your medical team about finding the correct balance for you and your body. Let's now talk about opioid-induced constipation. In palliative care, we often use opioid analgesics to help with the relief of physical pain and shortness of breath. But we are also aware that opioids cause constipation in most human bodies, albeit to varying degrees. How and why do opioids cause constipation? Opioids provide pain relief by acting on the mu receptor in our central nervous system. However, there are also mu receptors found outside of the central nervous system. And relevant to today's discussion, there are lots of mu receptors found throughout the entire gastrointestinal tract. This means that opioids also activate the mu receptors found in the intestines. And this leads to a reduction in peristalsis, an increase in fluid reabsorption in the colon, and an increase in anal sphincter tone. Put another way, your intestines end up moving slower. The extra fluid absorbed leads to dry and hard stools, and the decreased ability of your anus to relax results in straining during bowel movements and the sensation of incomplete evacuation. Does that mean I have an allergy to opioids? No. I frequently hear this from patients, but this is not an allergy. Although the severity can vary, the take-home message here is that the use of opioids causes constipation in the majority of people. This makes the prevention of opioid-induced constipation of great importance. To summarize part 1 of this video series, constipation is caused by many different factors. These can be broken down into lifestyle and situational factors, such as the lack of privacy, diets low in fiber, and the lack of activity or exercise. Constipation also has many medical causes, such as dehydration, electrolyte disturbances, and changes to the central and autonomic nervous systems. Constipation can also be a side effect of many different classes of medications, among which the use of opioids is a very common cause. Thank you very much for watching this video. Please stay tuned for part 2, where I will be discussing the strategies for preventing and treating constipation in the context of advanced illnesses and palliative care. Hope to see you then.